So Meridell is unique in the sense that we provide two distinct programs for our services. We have our behavioral residential program and we have our neurobehavioral program. The behavioral program is definitely more of a supportive peer culture approach where the kiddos are really holding each other accountable, working with one another to problem solve. It's highly encouraged and direction is provided by the staff. And whereas the neurobehavioral program is very unique from a nationwide perspective, that's probably where we garner a lot of our interest out of the state of Texas, is because we work with a lot of high functioning autism spectrum disorders. A lot of them are even undiagnosed. And so it could be just generalized ADHD even. But we're also able to provide on-site psych and neuropsych testing for all of these kids upon admission, generally within the first 2 to 3 weeks, which allows us to distinguish very defined treatment plan goals, which is what allows our clinical or our treatment team to maximize that benefit length of stay for the kid. So our behavioral, like I said, program, that's for a lot of mood disorders, kids who have generalized anxiety, depressive disorders. I'd say Meridell stands out above the rest just simply because, we have 5 full-time providers or psychiatrists. Most RTCs do not. We're also, we were established initially as a medical model, and currently we're trying to transition over to a clinical model. But Meridell offers a lot to these families because we're able to really dig into the details of what's going on with, from a trauma-informed care approach, not what's wrong with my kid, what happened to my kid, to really see how we can work with the families to also get them on the same treatment plan in a sense, to have a sustainable approach when the kiddos return back home with them. So there's a lot that we offer here. And if you've never been to Meridell, beautiful campus, 65 acres. We've been around since 1961. So not a lot of organizations who've been around for that long with the clinical outcomes that we've been able to provide into the community. Business development is realistically managing relationships. And when I say relationships, that's with community stakeholders. A lot of the entities that are referring to us are typically other psych hospitals or even affiliated partnerships, such as a UHS-owned facility. That's probably where we get about 80 to 85% of our patient referrals. We also work with a lot of psychiatrists, a lot of providers such as pediatricians, mental health professionals, ed consultants. And here at Meridell, really, we're looking to see not just how can we better message what we do, but how to also better provide resources to those communities who aren't as familiar with what we do. So we're always seeking out new partnerships. And on the back end, I would say a lot of those stakeholders that we're discharging our patients to, making sure that they're also aware of how we've worked with that kiddo in a lot of cases. Sometimes they may have not referred to us directly, so inadvertently they're just getting the kid back. So connecting with them, informing them, educating them about our programs and services and how to further make a referral. So again, in essence, it's really managing relationships for the organization here, so that we can meet our organizational goals and mission, which is to really help families build a sustainable treatment plan for themselves and for their kiddos.